A pirate's favorite letter? You might think it's R, but it's really C, as the Medicare for the Lazy Man podcast knows for sure. The podcast that wants to grow up to be president. As a child, he tried to build a snowman out of rain. Medicare expert Doug Jones.
Hello, everybody. Welcome to another episode of the Medicare for the Lazy Man podcast. If you heard my Canadian nephew, Drew McMillan, announce my identity, then you know that I am Doug Jones, your Medicare expert. If you heard Drew McMillan announce my identity, but he didn't tell you that I'm getting over a nasty cold, then I must tell you that is why I'm having a problem enunciating properly and maintaining my mental acuity. So if you see anything oddball happening during this episode of the Medicare for the Lazy Man podcast, please call in and report it so we don't let the things that are untoward go on for too long. Anyway, I always start the episode by promoting my book, Medicare for the Lazy Man. The current edition is the 2024, and it's on sale at Barnes & Noble and barnesandnoble.com and at amazon.com. And within the covers of that book, you will find all the information you need to determine when to sign up for Medicare, how to sign up for Medicare, and what to acquire as your ancillary coverages in order to fill the gaps and the holes in Medicare. So with that knowledge, you will be the master of your Medicare future. And in fact, you're going to find that your Medicare coverage can be acquired easily without a whole lot of messing around and at a relatively good cost. Some Medicare coverages are better than others, and I point out which you should be looking for because quality is important. And then, of course, cost is important. So do you want to spend a ton of money on your Medicare health insurance? No, you don't. You want to get the most bang for your buck, and that is why I always suggest a certain course of action. If you purchase Medicare for the Lazy Man 2024, you will also know what that course of action is. So go to amazon.com or barnesandnoble.com, select your copy. You'll have several choices depending on where you go to get the book. Purchase it, get it home, sit down with a stiff drink, and before you know it, you'll be a Medicare expert just like I am. And Randy is working in that direction himself. He reads a page a day. And he says someday when he finishes the book, he wants to get a badge of accomplishment for his Medicare expertise. And I say, let's give it to him. Randy, good to see you again.
Well, thank you, Doug. It's good to be seen. I hope you're feeling a little bit better than you have been for the last few days.
I just felt myself, and no, I don't feel that good, but I am recovering. The disease that tried to kill me has receded. I think it's surrendering, it's retreating, and I'm gradually moving back into the land of the living.
Good. Well, I know how much you enjoy these games that I dream up.
I do enjoy them.
I thought one more time that we would do Today in History.
Well, that's the reason I enjoy them is not because I look like a schmuck every time you do this. It's because I enjoy history. And every time I lose one of these games, I acquire new knowledge that I retain permanently.
I know. Me too. I consider myself quite a repository of bizarre facts. So I'm kind of like
bizarre
that
is
too.
the right word. Yeah. Okay. Well, good. Let's have another bizarre fact, and we'll see how bizarre it really is.
Well, we're going today again with Today in History, and this is a few years before you and I were born, but just in case, I am going to take you back to the year 1542.
Wow. I don't think I was even, let me do some math here. No, I wasn't around in 1542.
Neither was I. But I think you'll know. I'm pretty sure you'll know all about this one. So, today in history, what caused a very famous person to get a little lightheaded on today in 1542?
Well, I'm going to suggest that it was. Now, this was before the days of the French Revolution when the guillotine was used to cause people to get lightheaded. So I'm going to suggest this had something to do with the Spanish Armada trying to conquer England and failing miserably, being blown all the way back to Spain. And somewhere along the way, Sir Walter Raleigh managed to irritate Queen Elizabeth to the extent that he was either beheaded or caused to be executed in some way. Am I anywhere close to this? Because Randy's been doing paperwork and he's been preoccupied. I'm not even sure he's listening to me. Do I have the right country even in the history of the world? Uh-oh. You might want to turn your mic back on. Randy's talking up a storm and he has not realized that he's in total silence. I hate to have to call him and tell him that there is.
I'm back.
Okay.
I'm back.
So let's back up again and give me my hint that I requested so vehemently.
1542, and the hint you wanted was, were you even in the right country?
Yes.
And the answer to that is no.
Oh my God. Well, then I have to think, okay, what other part of the world might have had something going on in 1542 that we would know about? Because a lot of countries didn't have historians that recorded facts back then. So let me go with the guy who traveled around in China. Is it possible that Marco Polo, did it have something to do with Marco Polo?
No, it did not.
Oh, boy. All right. Well, I'm going to have to wave the white flag of surrender on this.
Are you going to have to wait? Okay, I get it. So anyway, long story short, 1542, King Henry VIII.
Okay.
And what he decided that he was tired of his fifth wife.
Okay. Anne Boleyn.
So, no, it was Catherine Howard.
Okay.
And so he trumped up some charges for her and charged her with adultery. And the end result was that was she was beheaded on today's date in 1542.
Okay. Well, first of all, I got to call an audible here. I did have the right country.
You said Spain, didn't you?
No, I said the Spanish Armada, but they were attacking England. And then I said something connected with that caused Sir Walter Raleigh to irritate Queen Elizabeth to the extent that he was executed. But in reality, it was a generation earlier. It was her father, Henry VIII, who was irritated with one of his many wives. And the irritation factor there, I'm pretty sure, was the fact that she flatly refused to bear him a son, an heir.
Oh, darn it. Well,
that's all she had to do.
We see what happens when she gets stubborn that way.
Yep, she just didn't listen.
Nope. Well, okay, so I'm going to give you partial credit.
I appreciate that. Thank you. But the cool thing is that I was expecting another Henry VIII thing. My first thought when you said 1542 was about Henry VIII's flagship, the something Rose. I think it's got two names, but it had the name Rose in the name of the ship, and when it set sail, or when it was removed from its moorings, it stood out into the body of water that it was floating around in, and then turned upside down, turned turtle, and sank. And it was recently discovered, I think like 25 years ago or less, and they tried to bring it back up, and it's now a mere shell of its former self. But that was a Henry VIII event that people didn't really know about until recently. And they wanted to save that ship because it was full of artifacts from the 1500s. So that might be a question, because I'm probably going to forget I even mentioned all that. And you might want to dredge up. It was the Something Rose that was a warship. It was a pride of the fleet until it just tipped over and sank for no reason.
Was it called the Lead Rose?
Okay, now I'm here. I'm seeing your lips move. It's like I'm your puppet.
Did you see it? Is it the Lead Rose? You said it was something the Rose, so I called it the Lead Rose. Is that it?
No, that's not it. It's going to be It behaved like lead, but it was really had a more picturesque name.
Ah, okay.
Now, if I were a producer of a podcast, I would probably ask AI or something. I would try to do a little research during the business end of the podcast so that we have the fact in order to complete the circle before the podcast ends. But that's on you. I'm not telling you what to do. What I am asking is,
you do need it. You do need a number, right?
I need a number because we're going to pick an article out of the stack of Medicare Advantage articles, and we're going to read an article, and I would like to know which article I should read. So would you please let me know which one you've selected for today?
We are going with lucky number 22.
Okay, let me find that one, number 22. And I'm crossing off number 22 from the list of titles, selecting the article, clamping everything together, and we are ready to go here. Article number 22. The headline is "The Government Scrapped Medicare Advantage Rule Over Industry Opposition." So it sounds like the article is going to tell us about the government starting to impose a rule, maybe one that's helpful to the sick people that need insurance coverage. But when the industry complained about it, they decided to drop the regulation. Let's see if I'm right. CMS, is the Centers for Medicare and Medicaid Services, dropped a proposed regulation that would have required Medicare Advantage plans to return overpayments found during chart reviews. And the reason they did this was because of opposition from the very people that they have oversight of. So to be like, if all criminals get sent to jail, but if a criminal said, "Hey, we don't like that jail, we want to go to this jail over here," then the government would say, "All right, we're not going to use the jail you don't like anymore because you're upset about it." Well, that's kind of what happened here. In 2014, the government proposed a rule that would have required health plans reviewing patients' medical records to identify potential overpayments. The government pays these plans to cover individuals, and they pay them based on the amount of medical problems they have. And so this rule would have required health plans that review patients' medical records to identify potential overpayments and return them to the government. Well, I can see the problem here. You're asking the fox to count the chickens and then provide an accounting of the number of chickens that the hen house contains. And then the next time the fox counts those chickens, you're asking the fox to give an accurate accounting. The fox may not want to do that because the chickens may have been fewer in number the second time he counted them. So the records released from a 2022 deposition show that government officials decided to abandon the rule over concern from insurance companies. The rule change is at the center of a civil fraud case against United Healthcare, the world's or the United States' largest health insurance company, and the one that we discussed in our last podcast episode is having a demonstration on the doorstep of its headquarters in Minnetonka, Minnesota. This civil fraud case has been pending for more than a decade. Apparently nobody's in a hurry to settle this. In records recently made public, the government officials said they decided not to move ahead with the regulation because of insurance company concern and pushback. The case in question was filed in 2011 by a former United Healthcare employee and was taken over by the Justice Department in 2017. The Justice Department alleges that it paid United Healthcare $2.1 billion, that's billion with a B, between 2009 and 2016 from unsupported billing codes, which it says United Healthcare should have removed. Because the proposed rule was not finalized, United Health said in a court filing that it should not be penalized for failing to follow a regulation that the government did not actually adopt. A government administrator told this news source in February that political forces in the agency has to contend with and have and will push back hard on charges like this. The government needs a lot of support and encouragement from the administration and the public to continue this journey. though I wish they would go faster and take on even more. Nearly every major payer, meaning insurance company that has Medicare Advantage products, nearly every major payer has been accused of or settled allegations of upcoding. In other words, making a patient look sicker than they really are. The practice of I could have just continued reading, that upcoding is the practice of making patients appear sicker than they are on paper in order to receive higher reimbursements from the government. The Justice Department and the government declined to comment. A spokesperson for United Healthcare told the news outlet its business practices have always been transparent, lawful, and compliant with government regulations. All right, well, I can't refute that because I don't have any direct evidence, but it is a persistent rumor that these Medicare Advantage plans are in the business of taking government money, and the more successful companies, the larger ones, perform that task more successfully. Now, since I'm having trouble speaking successfully, I think we'll take a little break for commercials and we'll see how the sponsors perform. Maybe I'll sound better to the audience after that. All righty, back and happy to be back. Chronic pain management. That's what's been on my mind lately. And the reason it's been on my mind is because that's the next section coming up in our Your Medicare Benefits 2024 manual. This is a big, thick book that the federal government decided to put out. I don't know if they're going to have a 2025 edition. I haven't heard about that yet. But they, in this book, discuss every possible item or procedure or medical condition that I've ever heard of, and then some. And they tell how Medicare is going to treat all of these things. So chronic pain management and treatment services, not just the treatment of the pain, but the services to assist in that treatment, I guess. Part B, as in Bravo, of Medicare, covers monthly services for people living with chronic pain, and that would be defined as persistent or recurring pain lasting longer than 3 months. Services may include pain assessment, medication management, and care coordination and planning. Now, the costs of that under Medicare, after you meet the Part B deductible, which is $257 this year, you pay 20% of the Medicare approved amount. Well, you don't really pay it because you were smart enough to buy a Medicare supplement plan. And what happens to that 20% is it's either paid by or credited by your Medicare, credited to your Medicare supplement coverage. For more information, visit medicare.gov/coverage/chronic-pain-management-treatment-services. And just as a little hint, coming up in future episodes, because we're still in the C's, as you can tell, we're going to have clinical laboratory tests. Well, that's got to be a pretty exciting, if short, entry. We'll also have some clinical research studies. So stay tuned for all of that. I know that there are people hanging on by their fingernails waiting to hear how Medicare is going to treat those kinds of procedures. And now, as I should stop using these bear clamps or maybe get like an assistant to handle all the clamps I have to use to keep all this stuff organizing. Heartbreaking Medicare cuts start to hit home in Congress. And this is a November 12th, 2024 article that was written right after the elections that we had. The famous and magnificent 2024 presidential election turned out well for more than half of the people in the country. And so in Lake Buena Vista, Florida, 700 physicians gathered over the last week for the 2024 American Medical Association interim meeting, a stone's throw from Walt Disney World, which is promoted as the most magical place on earth. But physicians will need more than pixie dust to make their dreams of protecting seniors' access to health care come true. They need support in Congress to back big changes to a broken system that is in line to cut the payments that support doctors' practices by 2.8%. January 1st is when those cuts are supposed to start, which would be early in 2025. And these cuts will further endanger access to high-quality physician care. That's why fixing Medicare is the American Medical Association's top advocacy priority, with leaders reporting significant progress in that effort. Already, a bipartisan majority of 233 members of the House has written to leadership demanding inclusion of a positive 2025 payment update for physicians in the year-end omnibus. What they're doing is they're asking that payment to physicians for treating Medicare patients be increased rather than reduced. I'm trying to read between the yellow highlighting here to make complete sentences out of what has been given to me by the content curator. And the goal here is to show Congress the real-life impact of the broken Medicare payment system on patients and on physician practices and the communities across America that doctors serve. To fix the problems with the nation's largest single health care payer over the long term, the AMA supports the bipartisan Strengthening Medicare for Patient Providers Act. So that's SMOOPS. That measure would give physicians with an annual Medicare payment update tied to the Medicare Economic Index. Okay. And they're saying it's not MOOPS, but MIPS. So I'm going to go with MIPS. Or maybe MIPS was the old law, and MOOPS is the current one. The MIPS replacement, called the Data-Driven Performance Payment System, that's DIPS, would also give CMS, that's the government, incentives to share data with physicians and improve the measures. Such changes are needed to protect patients' access to care in the U.S. health system, already facing widespread doctor shortages. I think that's the bottom line. We're going to cut doctors' pay. If we're already short the number of doctors needed to adequately take care of the Medicare participants that are in need of medical treatment, then I believe the idea is to increase doctor pay, not decrease it, so that it will attract more doctors to the practice of medicine, specifically the practice of, geriatric medicine, in order to treat Medicare participants. The AMA's research, the American Medical Association's research, shows that physicians' Medicare pay, when adjusted for inflation, has dropped by 29% since the beginning of the millennium. That would be the year 2001. 29% reduction in physician pay. In its final rule for 2025, the Centers for Medicare and Medicaid Services projects another 3.5% rise in the Medicare Economic Index, which measures the cost of running a medical practice. But the physician losses continue to mount, as one doctor noted, magnified in rural areas where patients today face a shortage of 20,000 primary care physicians, where 80% of counties lack specialty care and where 1,100 counties are without a single obstetrician. So that seems like a fairly serious problem, if in fact that's all accurate. A problem for all specialties and settings. It seems no matter the physician's specialty, doctors are speaking with one voice on the critical importance of fixing Medicare. The broken Medicare physician payment system is not just affecting physicians from all specialties and the patients they care for, it's also taking a toll on physicians in different practice settings, with seemingly no one being immune. After 4 years of Medicare payment cuts and a fifth schedule for 2025, unless Congress acts, there has been a major shift in how Capitol Hill sees the issue and its impact. As these cuts begin to intensify, really the problem that was already existing, our initial forays were to talk to folks from Capitol Hill a couple of years ago. The consistent message from lawmakers and their staffers was access is fine. All doctors take Medicare patients. We're not hearing anything about this problem except from you. So I don't think there's enough momentum to do anything about it. But Congress, as evidenced by the majority support for positive payment updates for 2025, is starting to see the reality of the situation. Every way we can continue to talk to members of Congress to make sure they understand the magnitude of this problem, the impact is going to have on your ability to care for patients who are on Medicare. So the doctors are saying we're in dire straits and we need to increase our revenue in order to attract more doctors, especially in rural areas. to treat Medicare patients. Seems very reasonable to me. I certainly want a successful doctor treating me who is happy in his work and who is confident of his continued prosperity. I'd rather have him than a doctor who is, unhappy and basically his earnings are less than substantial. That would not be my choice of doctors if that were the only criteria that I could adhere to. So we get some articles and we get some correspondence. This is a piece of correspondence from a client of mine who's been around for quite some time. Her name is Shauna. And she says, "Good afternoon, Doug. I hope you had an enjoyable holiday and a happy new year. I haven't received a 2025 policy or a new ID card from my insurance company, my Medicare supplement insurance company, United American, yet. So I just wanted to check on that. Also, I wondered if you happen to know if I need a referral from a primary care physician to go to another doctor with either Medicare or United Healthcare or United American insurance. Medicare is what she has, and then her Medicare supplement is from United American. Please let me know, as I have need to go to see an orthopedic surgeon for a frozen shoulder issue I'm experiencing. Thanks in advance for any information you can provide." And I said, "I had a great time over the holidays, as I hope you did as well. Medicare supplements are yours forever, and so do not have renewal documents or ID cards. Your United American plan will stay with you unless you fail to pay the premiums." So her initial question was, I didn't get a replacement policy or ID card, and I'm telling her, you're never going to get a replacement Medicare supplement plan just because we have a new year. Your Medicare supplement plan is yours forever. Now, your drug plan, on the other hand, will renew automatically, but I suggest taking a look at the drug plan each autumn. That would be from October to November, to make sure that your plan will be the best for you in the following year. Now, here is the thing about Medicare and your Medicare supplement. There are no networks of doctors or hospitals. You may seek treatment from any provider that accepts Medicare for payment, which is about 95% of all doctors. You do not have only one primary care physician. You can have as many as you need. You do not need permission to go see a specialist. You may seek treatment from any specialist that accepts Medicare. Complete freedom of choice is what Medicare and Medicare supplements are all about. So find a good orthopedic specialist and get your problem taken care of. And then I said, let me know how I can be of additional help. So it disappoints me when somebody who's been my client for a while expresses a misunderstanding like that, because it tells me that I have not done my job. If I had done my job, she would know that she's got perfect freedom of choice. That's the big deal. That's what I'm here for, is to help people understand that they, with a Medicare supplement and original Medicare, have complete freedom of choice. They don't have to ask anybody's permission to go see any doctor that accepts Medicare, and they don't have to ask anybody's permission for specialized treatment. They can handle their own medical procedures, and there's no insurance company that's going to get in their way. And speaking of people getting in my way, Randy is in the way of me going to take a nap and rejuvenating my voice. So Randy, do your magical stuff, would you please?
We're going to land the plane quickly, so make sure you've got your tables up and in the upright and locked position. Put your stuff back in the overhead. We're coming in for a landing on 33 right. However, before we do, here's several things I always want to take care of first. Get your pencil. If you want to reach out to Doug, you can do so using the email address dbj@mlmmailbag.com. Number 2 is, remember, Doug is licensed nationwide to help you with your Medicare supplement planning. Check us out at the website, medicareforthelazyman.com. We would appreciate, in your wanderings through the wilds of the internet, if you could drop a review for us. We're starting early this year to outrun the travel logs, and we want to start now and keep going. And last, but certainly not least, thank you. We really appreciate it. Thank you for joining us. You could have been anywhere else doing anything else, and you weren't. You were with us, which is exactly where we love to have you. But if you didn't check your watch, just to let you know, you have spent about 32 and a half minutes with Doug Jones, the insurance guy, originally from Oklahoma. No more. He's camped out in the high ground. And we haven't mentioned where the last couple episodes. He lives right at the fort, well, really, just really right at the foot of the Nosebleed Mountains. And he's usually in about 6,000 feet, but because he's not feeling all that well today, I'm going to take him down to about 5,200. So
What a guy. What a guy.
I'm a nice guy. What can I say?
Thank you so much, Randy, and thank you, ladies and gentlemen, for joining us today. I'm going to be looking forward to seeing all of you in our next episode. See you then. Bye-bye.